Afternoon, everyone. My name's Dave Matthews. I'm the chair of the Auckland branch of the Transportation Group. And for those that don't know, Transportation Group is a technical group within Engineering New Zealand. And we're all about trying to provide opportunities for growth and learning of our membership, often face-to-face, but in this case, this is lockdown learning via a webinar. So I'm going to hand off to an individual that's going to first of all introduce our two speakers today. And the first one's really about making lemonade out of lemons. So, Catherine.
Kia ora koutou. I'm Catherine King from Kotahi, the New Zealand Transport Agency. I'm here to introduce some research that we commissioned out of the back of the first COVID-19 lockdown last year. We saw a whole lot of work happening here in cities in Aotearoa, and we also saw what was happening in other cities abroad. And we really wanted to understand what were some of the factors that contributed to a successful response to reallocating street space to keep people safe and to enable people to get out and exercise or access local services. We also wanted to understand how we could improve on what was done here, taking some of those lessons from here and abroad to prepare us and make us more resilient to future challenges. So Kirsty Wild from the University of Auckland is going to be talking you through some of that research, and at the end of the webinar we'll be available to answer some questions. I'll now hand over to my colleague Jo Chang, who's going to introduce another piece of research that we led.
Sorry, Jo, you're just on mute there.
Rookie mistake. Sorry about that. Kia ora katoa. Ko Jo Chang, taka ingoa. It's my pleasure to introduce Gria Hawley, who's going to talk about a piece of work that she did while she was at Mackey Research on leveraging transport disruption to influence change. And this research project came about, as kind of Catherine was saying with her one, as we were going into that first lockdown, we started to think about, well, what are the things that we're going to need? What are the things that we're going to need information on? And we set off about 4 projects at the same time. This was one of those projects, and we were really interested to know from disruptions in the past, what can we learn from those disruptions? And did those disruptions, how did they impact people's behaviour in the short, medium and long term? And we knew that there was probably within that some timing of when we might want to do some kind of an intervention in order to get the most uptake or change in behaviour. Because kind of as a disruption happens, often there's like people have got limited bandwidth as they go into that at that point in time because they're too busy trying to react to that situation. So I'm going to hand over to Gria, who is going to start the first talk.
So yes, we did this piece of work for the Transport Agency. Thank you very much for the invitation to speak today. So it was all about leveraging transport disruption to influence change. And so this is published research on Kotahi website. And I know we're all very good at QR codes. So if you scan that QR code, not with your COVID Tracer app, but with your camera, it will take you to the report. So it all came from this idea that we hear a lot at the moment about not wasting a good crisis, and disruptions are an opportunity, or can they be an opportunity? But as Jo mentioned, they're also a time of stress and unpredictability and uncertainty. So basically, what can we learn about past disruptions that might be able to inform how we tackle COVID and other disruptions coming in New Zealand. I'm thinking climate change is our biggest disruption. So these are the more specific research aims. So basically, how have previous disruptions impacted people's transport behaviour, but also how have governments and institutions responded? Have they been able to leverage it as an opportunity? I mean, and fundamentally, it was how can we advance our transport policy goals through COVID? Or what can we learn to inform that response? So these are MOTs, transport outcomes there. So the methodology, so this work was completed in sort of May, June last year, and it was a very rapid lit review. I think it was sort of completed within the space of 2 to 3 weeks. So it's not sort of a systematic lit review that is published in academic journals necessarily. It was a rapid review to sort of inform how we might tackle this problem. We focused on academic and grey literature published in about the last 25 years and looking at previous disruptions to transport and that occurred in the last 40 years. There was sort of 2 elements to it, but very much interlinked. So looking at how people responded to disruption immediately and in the longer term, but also how institutions and governments responded. We didn't look at COVID. So this is, there was other work happening, as Joe said, other projects looking at what other countries were doing in terms of COVID. We also excluded disruptive technology. So that wasn't the focus of this. So there is a few limitations because there's just the research and the literature available is a bit messy. And as you can imagine, during big disruptions, it's not necessarily a time when you think to do a research project. A lot of the studies rely on people's recall. But in saying that, we were able to distill the themes from the literature, and I'm going to be talking about some case studies to kind of contextualize the findings and the lessons for us. So first of all, what do we mean by transport disruption? And so we defined it for this research as a disruptive event that impacts the supply, demand, or cost of transport, or a combination of all of those factors. And so it can vary in the scale, longevity, and type, from a very localized thing like a bridge collapsing, like a very small local bridge collapsing, or a whole population sort of transport disruption. It could also be planned, like a big sporting disruption like the Olympics, sporting event like the Olympics, or a construction project, or unexpected, like a big earthquake or flooding. Could be short and sharp, lasting 2 days, sort of like, for example, a transport strike for a week or a couple of days, or a more longer term disruption, such as, you know, our pandemic, economic recession, and major earthquakes. So as you can imagine, the type and longevity and scale of the disruption definitely impacts how people respond, but also how governments respond. And the other important point is the different phases. And so the literature sort of talks about the pre-disruption phase or context, the actual disruption, the immediate response, and then the more long-term recovery. And sometimes the sort of those phases can be quite blurred. But definitely the pre-disruption context is something that again impacts how individuals respond, and it could be sort of levels of community resilience, for example, or it could be the kind of the policy direction in the pre-disruption phase. So the typical pattern that we gleaned from the literature, and this is really looking at the typical pattern in terms of people's transport behaviour responses. So we have the pre-transport behaviour, disruption occurs, and then people are forced to respond. And that might be by changing mode, by changing the travel time, by changing their route, the destination, or reducing travel altogether. And then following the resumption of normal conditions, the typical pattern is that people's behaviour goes back to the pre-disruption behaviour. So there's kind of a blip, and the timing of that blip will depend on the scale and kind of the level of disruption that happens. So for example, in the SARS outbreak in 2003, we saw public transport ridership drop significantly, but then it sort of bounced back, and there was long-term behavioural disruption such as mask wearing and hand washing. So that is the typical pattern that we saw. There is an academic called Greg Marsden that's a bit of a guru in this space, and he sort of points to the fact that even if there is no lasting impact on transport behaviour, it's still it's a useful learning, and that the fact that people have capacity to change is also, and understanding how they change is actually really important. And also that disruptions can sort of shed light on social norms and the status quo. And a good example of that would be the Icelandic volcano, and I'm not going to try to pronounce the name, but that disrupted air travel in Europe for a good few weeks. And in the mobility field, that kind of threw light on society's hypermobility, and actually, do we need to be able to just travel all around the world at the drop of a hat? And that kind of thinking is actually carrying on into COVID. So even though it might not, as I said, produce a lasting impact on people's behavior, it can still throw up learning opportunities and sort of challenge the ways, challenge how we do things. The other thing to mention is that often it seemed in the literature there's quite a lot of pressure for governments to get back to normal as quickly as possible. So sort of that path dependent thinking to just get back to normal and everything will be okay. So there's quite a lot of forces happening in that post-disruption period. And in fact, it's not always positive. So there is some instances where people's travel behaviour may not quite bounce back and actually kind of get worse. So sort of think worse in the sense that, increases in driving that may have been seen post public transport strikes the ridership levels may not necessarily bounce back. And so there's a lot of sort of other forces and potential for adverse outcomes if we don't first at least focus on the mitigating factors. And we've got an example here from, this is a COVID example, but from a newspaper in Auckland, which is just an example of lots of other groups are also trying to leverage disasters or disruptions as opportunities. And there was some quite depressing examples from around the world. For example, the earthquake and tsunami in Indonesia, where groups were trying to get in and help communities rebuild, but also sending them into huge high levels of debt. So there are these other actors and forces that are happening in the disruption that don't necessarily take us in the direction that we want to go. And another good example of that, which is very topical at the moment, is the increase in road toll that was seen post the September 11 because of the fear of air travel. And so there was actually an increase in the road toll because of long distance driving of about 1,500 people. So keeping an eye out for so over and above leveraging it for change, it was sort of the overwhelming message from the literature was sort of first, don't go backwards. And I will get to my next slide. And I'm not going to talk about this in depth, but this is actually the Transport Agency data that was captured during COVID. And interestingly, it does kind of match that typical pattern that we saw in the literature where where transport behaviour does seem like it bounces back, but I think we have to be, this is from until November last year, but we do need to be careful that it is actually bouncing back and we're not actually ending up with you know, behaviour going in the opposite direction. So what else can we learn from other case studies or other examples of transport disruption? And each sort of example gives a slightly different insight or lesson. And we're actually quite lucky in the fact that the Christchurch earthquake is probably one of the best and well reported on disruptions in terms of learning from it. And so this has been formed from, you know, looking at published literature, the case studies that were done after Christchurch. So it's not necessarily our experience of Christchurch, it's just looking on information about Christchurch and following Christchurch. And so it definitely seemed like there was some support for a more livable and sustainable city before the disruption, which did lay a good groundwork or laid a good foundation. Then obviously catastrophic disruption happened, which led to huge disruption in transport patterns and workplaces and schools far from the city, and actually an increase in car use. And there was also a sense from the literature that it was about people wanting to have their car nearby as well, just in case they did have to get somewhere quickly. So it's those sort of lingering things following a disruption. But Christchurch leaders did act pretty quickly to come up with this building back better vision of the city, and this is probably one of the key lessons that we can take from that, is they had a clear direction, and you know, obviously there was push and pull and potentially some missed opportunities, but that definitely did seem like a strong factor in contrast to some of the other disruptions that we saw. And there was also a sense that it was a balance, and potentially a tricky balance at times, but between that fast authoritarian decision making that's often needed in a disruption, and then bottom up engagement and examples like Share the Idea campaign, getting people involved in what they wanted their city and their transport system to look like. And then also examples of system factors being adapted just to make it easier to make rapid decisions in that time, at that time. And that's a key thing that that author Marsden points to, is that you have to capture those adaptations that are happening within institutions, because if you can embed those in the status quo, that's when we kind of learn from it and can accelerate the change that we want. So it does seem like there has been a positive legacy from that catastrophic event for Christchurch. We've got the major cycle routes, we've got the low speed central city, pedestrianisation in the central city, but also things like the Māori Design Agency, where there's a much more central role of mana whenua engagement and in developing the city. So definitely a few lessons from Christchurch. And I'd recommend reading this paper from Brundias, and I've got the reference for you at the end. So this was actually a specific case study on the policy response and leveraging opportunities from Christchurch. And another thing they talk about as a positive is having a whole range of actors, and that was actors or people within institutions, but also within communities that were really proactively seeing how they could turn this into an opportunity. So it was a very proactive method. The Olympics is another interesting example, because it's often talked about as, you know, we can leave a positive legacy for our city. And in the case of London and Sydney, actually, there were significant changes in travel behaviour and patterns during the Games. For example, 75% of Londoners report changing their behaviour in some way, but a very limited evidence of any lasting impact on transport behaviour. And the authors sort of put that down to there was just not, they were forced to make a short-term adaptation, but there wasn't any change to the underlying motivations or norms around it. And also, yeah, I mean, the other important thing that Sydney pointed to was that they created a new agency to deal with transport during the Olympics, and they were working fast, they were making rapid decisions in response to things, but afterwards that was all disbanded, people moved back to their original roles, and all of that knowledge was lost. And so again, it's sort of taking the institutional changes and embedding those into the status quo. Another thing that another theme from the literature is the fact that in the pre-disruption context, those people who are already disadvantaged then can get disadvantaged by the disruption itself, but then also further disadvantaged by the policy response. And in the case of the Rio Olympics, you know, there was a huge promise for this disruption or planned disruption to make it better for people on lower incomes, better in terms of access, but there's been a number of studies that just say that actually didn't happen and they've resulted in poorer outcomes. So it's another sort of lesson for us is how do we place those disadvantaged groups at the centre of our response to COVID. And I won't talk to this too much because I need to move on to we need to move on to our next speaker, but the hurricanes in the States are also another quite interesting case study, because the lack of resilience in their transport system actually badly affected their evacuation. That was sort of the first lesson. I mean, there were positive things that happened, and they offered free public transport for 1 year immediately following the hurricanes, and they also talked about how different organisations were sort of forced to work together, and that was a real positive. But in contrast to Christchurch, their lack of a really clear post-disruption vision for their city really impacted on their coherent response, and they spent a number of years, it seems, just kind of flailing, trying to make progress, and that actually exacerbated the inequalities that already existed. And there were some other things in the context that, you know, just the existing distrust of the government, and that was exacerbated by the response. So a couple of further lessons there. And in our research report, we also talk about a number of examples from public transport terror attacks and how leadership was really used to ensure people weren't scared of using public transport following that. And then another interesting example from the Irish Recession, where they actually, so following their kind of booming years of the Celtic Tiger, they made a conscious pivot towards sustainable transport. But then it was sort of a bit of push and pull when then they used, you know, shovel-ready roading projects, and there just wasn't a consistent response following that, as we saw more so in Christchurch. But there's quite an interesting paper on that that row 2016, which I would recommend reading. There's a number of lessons from that Irish Recession and their transport policy response. So that was a bit of a whirlwind, and in the research we have we've distilled it down into a number of key lessons. And I guess the first one at the bottom there is just capturing the learning and the adaptation that happens. And I'm particularly interested in how it forces institutions to work differently and faster, and what that might mean for not only dealing with COVID, but also with climate change. As has been quite clear, having a very clear direction following the disruption is super important, as well as proactively involving vulnerable groups in how we respond. And I guess, even though it sounds extremely unambitious, and I'm hoping Kirsty will be able to balance this, but the first message is just not for us to go backwards, and we have to really be conscious of those those other forces that are trying to drag us back from the policy goals that we want. And that sort of lesson from the Irish example of having synergy between our transport response, our disruption recovery or COVID recovery, and then the wider goals that we want. And so, I mean, things like speed reduction in our town centres, where we're creating space for pedestrians and cyclists, but we're also thinking about what that means in terms of bringing people back into those spaces and stimulating the economy as well. So there we go. I mean, first of all, it's about not going backwards, and then alongside that, it's about proactively looking for those opportunities to turn it into a positive. And I have left some further reading for you there if you're interested in this. As I said, Greg Marsden is a guru in this space, and that's the Christchurch paper down the bottom there. And that's in addition to our report, obviously. So kia ora koutou, thank you for listening. And I will hand over to Kirsty.
Thanks, Gria. That was super interesting. I haven't actually seen a presentation on that, and obviously good connections in with this work on streetscape reallocation, our current crisis that we're in. I'll just share my screen. Yes, so kia ora everyone, I'm Kirsty Wild. I work at the University of Auckland in public health. I'm an environmental health researcher. This is one of the bits of research that I did for Waka Kotahi last year, and in environmental health and public health, we know that the best way to protect the health of populations is through creating safer environments. We have a degree of surge capacity. We can be hyper vigilant for short periods, but mostly we all need to, as leaders, think about how we're going to make safer cities while we deal with COVID. What we're thinking about climate into the future, we're more likely to have more disease outbreaks like we've got with COVID into the future. So this is one bit of research that we did, looking at how we could potentially use street space reallocation as a tool to help us fight COVID. I didn't do it by myself. Also, Gria was involved. Prof. Alistair Woodward, environmental epidemiologist who I work with in public health. Becky Thorne and Hamish as well. Hamish Mackey were involved in this research. So, you know, transport is just a key part of epidemics, of pandemics, unfortunately. You know, movement is what spreads the virus, but we also need movement in order to be able to you know, to get exercise, to access basic goods, to connect with other people. So we all face this challenge in lots of sectors of like thinking about how we can keep our communities safe, this challenge of infection control, but also like how we can support community resilience. How can we make sure that people can still get out, still have opportunities for social connection, you know, still can get food and access medical care, how we can keep businesses alive. We all face this challenge of a new normal, and lockdowns and the acute periods of infection control, but more generally, as probably we'll move into a situation eventually where COVID is more of a chronic issue for us. So why is, oh, I just need to move this around so I can see what I'm doing. Why is street space reallocation a really useful tool? And by reallocation, I mean reallocating space away from space you could use in a car to other social and active uses, things like walking and cycling, play space for kids, outdoor dining, other spaces to connect. Well, it's really important for three reasons in a pandemic. A, it can help you to prevent outbreaks. It can help you to manage outbreaks, and it's really important for supporting community resilience. So we haven't had so much focus on this so far, but outdoors is better than indoors, and generally overseas that's talked about a lot more. The more we can get people using outdoor spaces, and outdoor spaces in terms of reducing the chance of an outbreak. There's less spread of a virus if people are outside more, but also our communities are healthier if people are spending more time outside, exercising, etc. And so you reduce the severity of outbreaks when you do have them. Also, it's really important for reallocating street space to those other uses is really important in terms of helping us manage outbreaks. Things like lockdowns, if you want people to stay local, then local has to be livable. And that means that you need to be able to use it to exercise, meet basic needs for connection and restoration and basic goods. And also, it's particularly from an equity point of view, people who live in apartments, who are in crowded situations, street spaces are their backyard, are their outdoors. So they help us make stay-at-home orders livable, workable, and that links into number 3, which is just that if it's livable, these lockdowns, not just the lockdowns, but that longer term, perhaps chronic anxiety associated with living in cities potentially, if we look at ways to increase community resilience, we're more likely to continue to have buy-in for things like elimination efforts. Sorry, I've just got my video over my slides. So we did this bit of research looking at what's happened so far in terms of, we have had a few goes at using streetscape reallocation to help us fight COVID. So how's it gone so far? And has it been effective in terms of those 3 things that I talked about, preventing and managing outbreaks and supporting community resilience? What could be improved? We also had a go at thinking about what could we do at the 4 levels. We actually added a level 0. Like a bit of guidance, based on the evidence, based on what we know works and what's allowed at the different levels in terms of street space reallocation. And so we drew something up and got some feedback from people on that too. Just what lessons can be learned from this experience for other goals we have in transport. We did a lit review on best practice. We did interviews with local transport professionals who've been involved in reallocation efforts in Auckland, Wellington, Dunedin, Morrinsville, and 2 in central government. We also did some interviews with senior professionals overseas in Melbourne, Sydney, London, Bogota, about their work and how it had gone. And then, as I said, we had a little go at coming up with a bit of a framework of what you could do at the different levels. So we try to capture what exactly happened. So this is our first lockdown last year, mainly level 4 and level 3. There was kind of a different approach in different places. In Auckland, there was much more of a focus on physical distancing and making extra space for walking and cycling. In Wellington, there was this new speed limit introduced, this temporary speed limit between Breaker Bay and Owhiro Bay. That's really to support walking and cycling. Just the markings on footpaths and stuff. And there was a plan developed to implement some new footpath extensions and shared paths and bike lanes as well, but that didn't come to pass just because we moved down levels. In Dunedin, there was much more focus on trying to support the CBD and people coming back to the CBD and efforts at pedestrianisation. So the kind of what people tried to do was a little bit different in different cities and why they tried to do it. Yeah, so that's my first point there. The why was a bit different and possibly picked up on different parts of overseas responses. So how did people feel like it went? Like trying to do this new, potentially sometimes experimental stuff in like a stressful, slightly stressful situation. Well, people felt like there were examples that worked really well, like putting a temporary cycle lane in Tamaki Drive. Lots of people used it. They felt like it pushed them to be a bit more nimble. They good use of things, existing tools like emergency speed limits, forced them to collaborate across departments. They liked the Innovating Streets Emergency Fund. They felt like they were able to pull out some of their existing plans and use data that they had to come up with emergency plans. It stimulated lots of conversations about change. But they also felt like there were lots of barriers. It felt like there was lots of time pressure to get something up and running. Most people felt like there was kind of a lack of leadership in terms of that they didn't have the sense that they had strong support to do this stuff. And also, it's a bit of a weird chicken and egg thing we know in general with walking and cycling, but they felt like perhaps the fact that no one was out on the street meant that maybe these interventions weren't needed. So yes, so they just kind of weren't quite sure always about the why, like should we be doing this or is it needed or not. There were the same worries about social license around removing car parking. People also really worried, what does it mean, like when do we come out of an emergency and when does it become like business as usual where I'm meant to be consulting on this stuff? You know, can I put it in level 4 and 3, but then I have to whip it out at level 2 because it's not emergency powers anymore. So there was an over-reliance on cones and a fear, you know, the same old problems with using cones in the sense that people felt like businesses didn't like them when they moved down to level 3. They kept getting moved around. They looked ugly. There was a feeling that there was a lack of police support for enforcement around temporary speed limits. And just that engagement issue, like how do you engage in an emergency situation? Do you have to engage? Am I meant to? At a national level, it was interesting. We also talked to people at a national level about what they felt about how things had gone. There it was interesting. There's a really strong focus on liaising with with commercial transport operations, you know, freight, public parts of the transport sector where there's a commercial organisation you can get in touch with. So walking and cycling wasn't really on their radar, for instance. There was a sense that elimination means we want things to be, and the community wants everything to be as normal as possible. So they don't want to see anything different or experimental or, you know, weird. Council said they were worried about the cost of temporary traffic management and the social license. And in a sense, there was a kind of a sense that perhaps just work at home is better or get people to travel off peak. But there was also acknowledgement, well, how is this going to work in terms of the viability of our cities and our businesses if we're just going to ask people to start working from home? We also did interviews with people in London, Sydney, Melbourne and Bogota. They had similar commitments to making extra space for people walking and cycling. They also had a bit more of an emphasis on discouraging driving, did more street closures, did more outdoor dining. So I would say that they probably created a bit more of a sort of ecosystem of open air services, you know, like you have open air dining that you can bike to using your open air transport, etc. They felt the success for them in being able to implement kind of wider measures than we've managed here. They had a lot more support at the highest levels. They had some regulatory tools we don't have, like things like experimental traffic orders. They had existing plans ready to go that they were super committed to implementing and saw this as just an opportunity to do it. They were much more committed to providing temporary alternatives to public transport and had a stronger commitment to avoiding a shift to driving. I mean, here we actually had making parking free in a lot of areas. So we didn't have that strong sense that we should be avoiding a shift to driving. But they had challenges too, like the same stuff around the materials that you use, keeping traffic staff safe, conflicts as traffic returns. So we made a number of recommendations in terms of how we can do this better in a longer term sense, this time, next time, building on what worked well. Obviously, people have had a little bit of experience about how to do this stuff now, and there were some interventions people felt worked well. We definitely need to get better at telling the why story, having a strong narrative consistent with government messaging on COVID-19, creating more space to keep everyone safe and healthy. Priority going to protecting those who are most vulnerable, emphasising that the importance of streets for physical distancing and resilience, much more emphasis on prevention. We're very much in the transport sector thinking about what we can do in the emergency phase of things. But, the transport sector, as I've kind of talked about, has a really important role to play in making safer cities and prevention. And the fact that people aren't out on the street shouldn't necessarily be a sign that you don't need interventions. It's potentially a sign that you do need interventions as well. I think that's really important. We don't want people excessively isolating in their homes for long periods of time, and they might be not going out because it's just not safe to do so. And perhaps some guidance around what to do about the engagement issue. Having a nationally agreed way to do this. Do we need more regulations like the ETO, like the experimental traffic orders? Perhaps we need to work across transport and Ministry of Health a bit more. And what about some measures of success, process measures in terms of what's working well and what's not, but also outcome measures. What about things like measuring the usability of street modifications, evidence of physical distancing? Is it working? Uptake of walking and cycling, and the amount of physical activity that people are getting. And important to go beyond commercial operators and include cycling and walking advocacy groups in the emergency response. We're not going to have time to go into this, but I talked about how we had a go at trying to contribute to some national framework that we could use to get a sense of what you could put in at the different levels. I'll leave you to have a look at that if you're interested in that. So we sought feedback on that. In general, people thought that was really useful. It could be a really useful tool. Obviously, they prefer it to be guidance rather than a requirement, but in general, people felt like it was important to have that backing at a national level, and that it gave them more of a mandate for those changes, kind of formalizing a bit more social license. And so my final slide is that, through this process as well, Waka Kotahi just did some great work, breaking down exactly how you do all these sort of street space reallocation interventions. Yes, that's me.
Okay, that's great. Thanks, Kirsty and Gria. Now I'm just looking at the questions. We haven't got any specific that I can see on the question list at the moment. So maybe Maddie and I'll kick off with a couple, but certainly.
There is a couple just in the chat function.
Okay.
So George Weeks would like to ask Kirsty, it seems like one of the problems with New Zealand's emergency response was the lack of long-term commitment towards mode shift and reallocating road space. Do our road controlling authorities need to be advised by health authorities?
Well, it didn't seem that there was much coordination between the two, that's for sure. Like the only advice that the ministry had on their website was basically wear a helmet if you're going to ride a bike when it came to active transport, for instance. I don't know, George, do you have specific suggestions about how that relationship could work better? I
think-
wonder.
I was going to say, I think he'll need to put it in the chat. I don't think
Oh,
participants
you
are able
can't
to
give him
talk.
the ability to talk about it.
No, I don't think
so. I don't know of models about how they could work together more closely in a situation like this, but it would be great potentially to take some of that, the guides that Waka Kotahi have come up with. And, you know, I'd love to see them, you know, end up as something that was jointly produced by the Ministry of Health and Waka Kotahi, for instance. And then that potentially went out to councils. Yeah, it'd be great to see them work together more closely.
So he has said clear directions, I suppose, DHB telling Kotahi, AT, etc. to make space for people to get more than 30 or about 30 minutes of exercise per day, etc.
Yeah, and I know that certainly everyone was keen to get Ashley Bloomfield in those early days to say something about their particular issue. Like when I remember talking to, we talked to the DHB about this issue and like how we could get the Ministry of Health and Ministry of Transport working together. And Ashley did do a bit of a blurb about, you know, walking and cycling, and we're working with Kotahi. And yeah, I think my strong sense is that the DHBs were really overwhelmed every time we have an outbreak. You know, we've really underinvested in all aspects of public health, and including, you know, our pandemic response. And certainly, you know, I've got students at the moment who are leading contact tracing who, you know, they just work every hour of every day when we have outbreaks. So I feel like, I mean, maybe this is just something for us to think about with the new public health agency as well. You know, they mention support for this sort of stuff. Yeah.
If I may jump in, Kirsty, sorry, Hamish Mackie here, sorry, Maddie. I think another thing that came through, I think Kirsty's exactly right, but it seems there was also just not a sort of, even just a general awareness of some of this stuff as being important, you know, compared with the issue of, you know, the important issues of, say, keeping people safe on buses and off, you know, and physical distancing in general and that sort of thing. And so I think there's even just an awareness that, you know, people's physical health and mental health and ability to get exercise is actually an important thing, and to have the sort of Ministry of Health, you know, appreciate that within this COVID and transport context would be an important thing, so they can actually sort of ask the transport world to do things.
Yeah, I'm not sure how we specifically get to that point, but you know, I think everyone was very overwhelmed last year, and now is another opportunity to just keep working at that. You know, when David Skegg says the worst is to come for us, I mean, that sounds a bit overwhelming and perhaps a slightly negative way to look at it, but what he's kind of saying is, you know, we really need to think about what it's going to be like for this to be a chronic issue rather than just acute lockdowns. And other countries are ahead of us in terms of having to really think about how they make their cities much safer spaces. And, you know, people that we talk to and at a government level were kind of like, well, it just hasn't really been that bad here. It's kind of hard to you know, say to the community we want to do anything differently, but you know, we possibly have a more challenging phase in front of us, and so perhaps it's a time to go back to you know, the Ministry, Waka Kotahi, and the Ministry of Health again, and just share this evidence, talk about this stuff for sure.
Thanks for that, Kirsty. So there's another question here from Thomas Nash, and it's mostly for both speakers, and maybe Gria, or if you kick off, and maybe Kirsty, you can also add something to it. And the question is around political pathways to transport change, and what we need to learn about the street space allocation efforts in COVID times. And in Wellington, Thomas said that he feels as though it was quite a challenge. So I suppose it's talking about the why that you were talking about, Kirsty, but also in terms of Gria, sort of choice, behavioural choice, and capacity for people to actually change and cater with change. So Gria, you able to kick off and then Kirsty add in?
Yeah, sure. I mean, I don't know if I'm exactly answering your question, Thomas, but I think an interesting thing to point out also, and this sort of was a theme in my work, where it might not, the disruption might not lead to change right there, but it might create kind of a bit of a ripple. And I know for Wellington, with the COVID experience and trying to reallocate space, some of that, they made a decision not to implement some of those routes. But now, a year later, some of those were actually funded through the Next Innovating Streets project. And now I believe Wellington City Council has sort of committed to a bit more of a rapid rollout of temporary cycleways. So I think in terms of that political will and change, sometimes we just have to look for those opportunities to create that ripple, I think.
And Kirsty?
Yes. So I mean, I agree with what Gria is saying there. I mean, we face this challenge all the time with every effort to transform our transport system in terms of street space reallocation, whether it's for climate or safety or yeah, and it was hard hearing people say that even in an emergency situation, they were just worried that there would be that they just didn't have the social license to do it. I think that I guess, people who know me know that I feel like there's probably not enough legislative support for street space reallocation or, requirements to make streets safe and healthy places. So we probably don't have heaps of time to talk about that now, but just at a very basic level, it's certainly in the UK, they use experimental traffic orders and they really came into their own in dealing with the pandemic in terms of actually having that ability to just put something in and then consult on it within 6 months, make a decision within 18 months. They just have way more tools than we have here. Yeah, so I think we need more legal requirements to create safe and healthy street environments, and something like experimental traffic orders is just perhaps one of those tools we could be using. COVID and beyond.
Thank you. Yeah, those are both really good answers. So there's a question from Alex Dyer here. So it's kind of asking about how do we address the lack of leadership? So just in terms of like making these shifts more of a priority and more longer lasting.
We need to elect better leaders.
Gria, do you have any comments, Gria?
Yeah, that's a hard question. And I guess I go back to my previous example about, that kind of idea of starting small and scaling up and really showing the good examples of where it can work. Yeah, I know that's probably not a great answer, but I think it's something that we're all grappling with at the moment.
Sorry, Gria, I guess building on that, I think one thing that you presented that was really important though was sort of letting the plan doing the talking. And so, if the leaders have those plans, and I guess this comes back to Kirsty's point about sort of legislation and some, some stated direction, then it's not just about a person saying we should do something, isn't it? That person can be they can be the conduit for the plan, but if we have, I think you showed us really nicely that if those plans are in place already, and to some extent Christchurch had that, then it just takes someone with a bit of energy to make the plan actually start getting operationalized. And we do know there is a bit of a disconnect in a lot of areas between some of these great plans that we've got and then the operationalization of them in so many different areas. And that's another issue, isn't it, down a bit further down in the delivery system. But yeah, certainly having those plans seems really important.
Yeah.
Yes, that is actually a really good point, Hamish. And I remember there was a great quote in one of those Christchurch papers from Glenn Curry, sort of saying that we actually don't need a crisis or a disruption to create better cities, or we shouldn't need a crisis. But yeah, that is a great point about having that plan to set the direction.
And I think, oh, sorry.
Yeah, I'm sorry. I just want to make a quick comment on that public health and transport and the link between the two, because I know like we do have a knowledge hub that's set up by the Ministry of Transport at Kotahi, and we have public health person on that as well. So it's an equal three-way partnership. So I think some of that stuff is starting, you know, like there is definitely those conversations being had, and it's probably Catherine would probably speak more to that. But yeah, I just quite add that in there.
Is that a new thing, Jo?
No, that's been around for, well, because it was Claire, now it's Catherine. So they have that, I've been interacting with them since I've only been at the agency for 2 years, so probably be just in the last year. Yeah.
Mm-hmm.
Okay, so thanks for that, Jo. So I think we're pretty much out of time, but if I gave Kirsty and Gria sort of 30 seconds each to say what's the message you want to leave for everyone that's attended, is there an underlying message you want to send or talk about in terms of your presentation?
Oh, I didn't know this was, oh, sorry, Gria, you go. Sorry, I've leapt in there. Gria, have you got your 30 seconds?
Oh, well, I'll go first. And I actually just saw a comment from Claire Graham about using, you know, things like construction projects as disruptions, but turning those into opportunities. And that is definitely something that we came across in our report as well. So things like the CRL, like how could we have leveraged that as an opportunity more? That's a great point from Claire. I guess my last 5 seconds summary would be, you know, during COVID, there was some rapid decision making enabled. Like we wasn't there free public transport at certain times, and there was rapid street allocation. So what enabled that within our institutions to make quick decisions that we're going to need to tackle climate change would be my question. What can we learn from those institutional working arrangements that happened?
And Kirsty?
Yeah, I would just say that, you know, it's we have lots of amazing professionals, heaps of people in New Zealand with lots of great experience in terms of the challenge of thinking about how we you know, maintain city livability through this experience, you know, with COVID, with climate. Yeah, it's just a conversation that I think we need to start having more, you know, not just the emergency situation, but just daily life, the fairness in terms of, you know, who has access to our public spaces, why our public spaces are so important for restoration and connection and for the economic survival of our cities, and how we need to get on with this stuff. Yeah.
Fantastic. So I'm sure everyone enjoyed that from Kirsty and Gria, and certainly appreciate the time, and thank you everyone, and have a nice afternoon.
Thanks, everybody.
Thanks, everyone.
Bye.
Kia ora.